My name is Rosa Mendoza. I'm the founder, president, and CEO of Alvanza. Thank you for joining us for this timely conversation on the role vaccines play in advancing global health. Before we begin, I want to acknowledge our event partners, the National Hispanic Health Foundation and the Health Equity Collaborative. Thank you so much for your partnership. As policymakers consider decisions that shape vaccine innovation and access, it is essential that those decisions be guided by scientific evidence and expert consensus rather than misinformation or political pressure, especially when these innovations have the potential to save millions of lives. Today's discussion will explore how scientific breakthroughs and technological innovation, from next generation delivery platforms to advances in small molecule drugs, are transforming how vaccines are developed, delivered, and accessed. Vaccines remain among the most powerful and proven tools for preventing disease, protecting families, and strengthening health systems. And innovation is expanding their impact in ways that accelerate discovery, reinforce global health security, and bring life-saving solutions to more communities. We are very fortunate to be joined today by an outstanding moderator and a very distinguished group of speakers who will bring deep expertise across science, medicine, policy, and innovation. Together, they will guide a thoughtful and looking forward discussion that connects cutting-edge research to practical public health outcomes. I am pleased to welcome our moderator, Dr. Elena Rios. Dr. Rios, the floor is yours.
Thank you, Rosa. It's a pleasure to be here with Alvanza and the Health Equity Collaborative, great partners, especially in this time of misinformation. We are really focused on bringing more information to our communities, and I like what you said about public health outcomes as our goal. And public health to me means building a society where everyone takes care of everyone, and that we all work together, whether we're in the public or private sectors, and of course in the private sector, academics, nonprofits, hospitals, clinics, our providers, community health workers, we all have to work together and have a more multidisciplined approach to what we call innovation. And innovation really means coming from the ground up and having the best minds put together ideas that can help everyone. So I'm really happy to have a distinguished panel. Dr. Jerome Adams, former Surgeon General, and now the director of the Health Empowerment and Learning Center at Purdue University. Dr. Yvonne Maldonado from Stanford University, a longtime representative of the American Academy of Pediatrics, former representative on the ACIP committee, researcher extraordinaire in this space. And Dr. Maldonado is now vice provost for faculty advancement at Stanford University. And Ms. Candice de Mateus, the president of the Partnership to Fight Chronic Diseases. So with that, I have a series of questions that we are going to ask. And we would like all of the participants, and we want to thank all of you interested in this topic, to put your questions in the chat box. We will get to some of the questions at the end, but we do have some questions already prepared. And I want to thank everyone for joining us today. For the National Hispanic Health Foundation, especially, I just wanted to mention that we do have great staff that have been behind recruiting and implementing this webinar, and I want to thank all the staff that are on our call. So today we have our first question for Dr. Adams. Dr. Adams, can you share an example of innovation that has significantly reduced time from vaccine discovery to deployment? You're on mute. Jerome, you're on mute.
Yep, thank you. It just allowed me to unmute. So thank you so much for having me here today. And as far as an example, a clear one is Operation Warp Speed. We took a process where the record for vaccine development was the mumps vaccine, taking over 6 years. And in less than a year, we were able to develop a vaccine for COVID. And I want to be clear, we didn't skip steps. In many cases, we were working in parallel versus in series. Manufacturing started before the trials ended. Regulators were reviewing data in real time versus waiting for all the data to become accumulated and then dumped into the FDA and then reviewed back and forth. And quite frankly, decades of prior mRNA research also paid off. So I'd say the lesson is simple. Speed comes from removing financial and bureaucratic barriers, not from lowering scientific standards. Parallel manufacturing and trials were key, rolling FDA reviews were key, and long-term investment enabled rapid response in a crisis. And that's something we don't want to be political here, but I do think it's important for us to acknowledge that we're losing some of that investment that enabled us to respond rapidly when COVID hit us in 2020.
And Dr. Maldonado, as Dr. Adams just mentioned, and in all of you, I guess I should refer to you as Jerome and Bonnie. You're all friends, but I do want to say that I think it's important to talk about recent advances in science and technology that have accelerated vaccine development compared to a decade ago. Can you tell us more about that?
Yeah, absolutely. And again, as you heard, really happy to be here. Thank you for the invitation, and I fully agree with what was just said. I ran the trials here at Stanford University. I set up the COVID policy committees and at the university as well, and as well as in the medical school. And I have to say that Operation Warp Speed is a really good example of how deployment, when unified and communicated well, and has $9 billion of support to do the work rapidly. So it's not, again, cutting corners, but it's actually allowing people to work as quickly and efficiently as possible in parallel with sufficient resources to do so. And what we've seen over the last 10 years, I think, is there had been, up until recently, there had been a fair amount of opportunity to build that science and technology. So moving away from cell-based platforms, for example, in building influenza vaccinations. And I know Dr. Adams is quite a strong proponent for influenza vaccine, and we know that we've done a very good job. It's the uptake, unfortunately, people, didn't have either the resources or interest in moving away from cell-based therapies or egg-based to cell-based. And I think that really made a big difference in being able to produce vaccines much more quickly. Again, you mentioned the mRNA platform, which has really revolutionized the way we can think about vaccine development, because you can take, if you know the protein or the target that you want to identify for vaccines, for example, and you have this genetic sequence for that, you can actually turn around and manufacture that within an 8-week period and can scale it up pretty rapidly. So, for example, with the current potential for avian flu or highly pathogenic avian viruses around the world, if we have stockpiles of these vaccines for human use, if we needed to switch those out, we could do that in fairly rapid time. But again, it would require not only the resources for the science and technology, which we actually have available to us. That actually has moved pretty well in the last several years. We also need the deployment.
So with that, I'm going to go to the one next step to Mrs. de Mateus. In what ways are vaccine innovations contributing to stronger global health, security, and pandemic preparation?
Well, thank you also for having me, and please call me Candace. That's no problem. Our ability to maintain and improve health to address some of the diseases that have the highest burden of illness globally, including many chronic diseases, cancers, Alzheimer's disease, heart disease, all are hinged on our ability to prevent and treat infections. And vaccines are a critically important tool in those efforts. So if you think about it, every high-tech surgery, it could be state-of-the-art, innovative, organ transplants, regenerative medicine, innovative cancer treatment, all of that depends on our ability to lower and, to the extent possible, eliminate risk from infections. And those take place everywhere, on the battlefield, in every town of America, every town across the world. So, and nature is amazing. It continues to evolve. And when it comes to our preparedness against emerging bacterial, fungal, and viral threats, we have to keep one step ahead of that evolution. And that's where innovation is so critically important. It also means utilizing the tools we have, and that's, vaccines to prevent illness, as well as other tools. It means developing new tools, including antibiotics, antifungals, to address antimicrobial resistance. And it means investing in data collection and analysis to be able to spot emerging threats early and to address them. We saw in real time, as the doctors just talked about, Dr. Adams and Dr. Maldonado, about the power of vaccine development with COVID-19 and the potential power of that mRNA platform to accelerate vaccine development in other areas. Research is ongoing today to train a cancer survivor's immune system to recognize the cancer threat if it were to recur and use their immune system to fight that cancer. That's remarkable. We're also seeing opportunities to, vaccine clinical trials against Alzheimer's disease. So there's a lot of opportunity here, not just against infectious disease threats, but against chronic disease threats, and vaccines play a critical role there.
Can I jump in really quickly? There's
Sure.
a lot of conversation going on now about vaccines being more of a individual choice. You're hearing a lot about shared clinical decision making, but I want to suggest another framing that's important to respond to your question. I think we need to understand that vaccines are national security tools. They are. When we look at a world that has become more globalized, and there are more threats to our national security, intentional, but also unintentional. We don't have this is not the place to debate the cause, but it is inarguable that the planet is warming. And as the planet is warming, we're seeing new disease threats emerge. And the fact is, faster platforms such as mRNA, regional manufacturing, and global surveillance, which is a big part of this too. It's not just responding, it's being able to see what's going on. And we had real difficulty with that during 2020 and COVID. They all allow us to respond before health systems collapse. So preparedness isn't just stockpiling doses in a warehouse somewhere. It's about maintaining trust, cooperation, capacity, and readiness between crises. And I'm going to be a broken record here, y'all, but I'm worried that we are falling short in most, if not all, of those areas in recent times.
Well, and to add to that, since we're on the time, we weren't talking about preparedness, but I've worked most of my career in global child health in sub-Saharan Africa and in indigenous populations. And I can tell you right now that with $100,000, I was able to set up a really sophisticated laboratory in Zimbabwe that was able to do surveillance eventually with the World Health Organization. So it got certified and was able to do surveillance. So it doesn't take a lot of money, to build these networks. And in fact, as you heard from Dr. Adams, we have networks around the world already, over 145 sites around the world that track influenza and polio and other pathogens and have the opportunity to do other things. For example, tracking HIV resistance, tracking antimicrobial resistance. Wastewater surveillance is not expensive to do. We could do a lot of the surveillance for very inexpensive, relatively inexpensive costs. And in the 90s, the United States first put up infectious diseases, as you alluded to there, Dr. Adams, as a global health security threat. Because when you destabilize populations, and history tells us this, going back to the Greeks and Romans, and as early as Napoleon, infectious diseases and these threats actually kill more people during wars than actual injuries. If we are not aware of diseases that travel around the world in real time, we risk not being able to deploy our technologies as rapidly as we can. So surveillance, as an epidemiologist, I can tell you surveillance is, people think it's not exciting, but it's really important to understand what's going on around the world and be ready, because we do have the capacity to be ready.
Amen.
Thank you both. Let me just remind the audience to please mute all your microphones. Thank you. Let's continue here. Mrs. DeMatteis again, or Candace, let me just start with you, and everybody please jump in. But how do small molecules and vaccines complement each other? in addressing global disease challenges, and also what role does innovation play in ensuring vaccine access? And as Bonnie just mentioned, in more underserved and low-resourced communities. Do you want to start, and then we'll go across the other group, the other two?
Sure, happy to. So, small molecule medicines are the things that most of us think of when we think about medicines or drugs. Those are like pills, capsules, could be a syrup or a patch. They involve, pretty simple manufacturing in terms of, how they're produced. Handling is easier. They tend not to require refrigeration or transportation. And administration is much simpler than some sophisticated things that may require refrigeration or IV administration, for example. So that's why they are critically important, as are vaccines, because in addressing global disease challenges or even regional disease challenges, but particularly for underserved and low resource communities, vaccines, many of us know, require refrigeration, although I'm going to talk a minute, there's some innovations on that front as well. But they are, single or multiple dose, but spread over time. So it's not a constant need. So that you can build infrastructure around mass immunization events, for example, in underserved or low resource communities that get the community together and can effectuate vaccination in a short time frame. So that's why both of these serve such an important disease prevention, disease management tool in these under-resourced areas. One thing I wanted to say too, that on the innovation front, since we are focused on innovation, there are innovation and research projects underway to make vaccines more accessible that help promote their stability without needing refrigeration or other technology. And it's critically important because then you can reach everyone and in different areas. Less than a year ago, for example, biotech companies announced clinical trials for the first vaccine formulation that doesn't require refrigeration. And those trials continue. And they're working on existing vaccines, but reformulating them so that they are easier to handle, more stable, and can allow a longer shelf life and reach more people. So that's really important. Another exciting area of research in this area is the development of what they call edible vaccines. So it's working with genetically engineered plants and food sources that synthesize proteins to induce disease resistance. A lot of those are really focused in on infectious diseases around cholera, diarrheal diseases, but also include hepatitis B, C, and E, and even measles. So none of those, as far as I'm aware, are out in practice, but trials continue. And really exciting areas because, again, if we can reach everyone, we can do things like eradicate smallpox. And that's huge success. But, addressing these infectious diseases and making these medicines more available to everyone.
Candace, I love
Can
that
I just add a comment here?
Yes.
I have seen, and I agree wholeheartedly with what you said. Unfortunately, we have been working on edible vaccines, on micro patch vaccines. These are little tiny, like Band-Aid, like little round Band-Aid type strips with micro needles that you don't even feel. I've tested them on myself, and you just put them on. You don't feel the patches, and you can actually vaccinate. And they're biodegradable. They just fall apart. Those have been in testing since the 80s. We have been working on the technology is all there. So this is almost like what we saw with COVID, where the launch of mRNA vaccines really took political and public will to get these products out. It's not for lack of innovation, as you said. I live in Silicon Valley. We have this innovation, but sadly, biotech startups now are really mostly focused on AI. And there's nothing wrong with AI. I think it's a great place to go. But you are seeing a dearth of venture capitalism, and if you look at equity, it's not going into the biotech field anymore. It's really difficult. And I'm seeing that in our graduates here at Stanford who are moving on into jobs. They're not able to find biotech careers because the focus right now has been away from biology and more into the AI space, which I think is important. But we need to, and I know Dr. Adams has this experience at the federal level. How do we move, and now maybe the global level, how do we move these amazing products that we already have and that we can continue to evolve and innovate? How do we move them into the space where they can be deployed in larger scale, because the edible vaccines have been around for a long time. The micro patches, those would be so easy to deploy. You're right. We literally could have eradicated measles about 20 years ago, I think. So we
Yeah.
can do it, and we should be really proponents for supporting the ability to scale up these possible solutions. And
Can
by
I
the
round
way,
out that innovation
Very good.
conversation super quick? I just want to say really
Sure.
quickly, innovation isn't only what's in the vial or in the factory. It's also delivery, trust, and access.
Yeah.
And so when you look at COVID, one of the biggest things that we debated early on in terms of access, and this has been brought up, but I just want to put it in the context of COVID, was the fact that the vaccines had to be kept at an incredibly cold temperature. So when we were looking at, for instance, the tribal nations across the country, it was very difficult to get a vaccine at minus 30 degrees out to 4 hours away from the nearest airport in Montana. So heat stable vaccines are going to be important locally in the United States, but also globally when you look at places like Africa and India. Pharmacy-based care, mobile clinics, we saw a big expansion of these during the pandemic. Some of the funding has been taken away, but those are also ways we can make sure we're putting vaccines where people are. And then community messengers are going to be just as important as the science itself. We need to innovate in the way we're actually getting vaccines to people and not just innovate in terms of the development of the vaccine itself.
So there's some questions coming into the chat, but there's only a couple more questions that we had prepared for you all. Let me jump to the next question. And this is for all of you. How important is it for policymakers to rely on scientific evidence and expert consensus rather than misinformation or political pressure when shaping policies that affect vaccine innovation and access? And I want to emphasize access because you're really pivoting here to the importance of not just deployment, but getting to the communities that need it, and decreasing the disparities that we all know about. So how important is it for policymakers to rely on scientific evidence when shaping policies that affect vaccine innovation and access, especially because they have the potential, the vaccines or the different innovative ways of delivering vaccines have the potential to save even more millions of lives. Bonnie, do you want to?
Yeah, well, I mean, obviously I have two experts here sitting on either side of me, but so I've done a lot of policy work. I've been again, as the others have, on many federal and global committees around access as well as the science. I mean, the science community is pretty, I think we have a very good sense of where we have been and where we would like to head. I think we have a major lack of public trust at this point. People do not believe in science at this point, or at least they doubt science. And science is not a fixed thing. Science is an ability to strive towards doing better and improving what facts and research we know. And so I think that is the key question here. And one of the things that had worked in the past is really working at the high level to incorporate key stakeholders from communities across whatever your population is, and to really engage across multiple populations so that people feel that they have a stake in what's the outcome would be and that they are able to participate in the process. For example, let me give you what you mentioned, the eradication of smallpox. We note that Bill Foege just passed away this week. And Bill Foege, I was at CDC as well. I was a public health officer myself. And Bill Foege was responsible for helping support the major innovation, which was ring vaccination. So rather than doing mass vaccination, he didn't have enough smallpox vaccine to really eradicate smallpox in India, for example. And so when he went to India, he worked with the local physicians and community leaders, and they talked about the best strategies. And the best strategy for them was one smallpox case they would vaccinate communities just within that case and able to then contain the disease. But it required a lot of trust among the caregivers and among the population. And those people then worked with government officials as well who were skeptical about this approach. It ended up eradicating smallpox in India. And what it says not so is also important. It says a lot about the technology, but also says about the innovation in building a strategy that's relatable to a local community, making sure that the local individuals feel comfortable with the idea and that they're able to bring the message to their own stakeholders as well. And I think it's harder and harder to do that nowadays because we are very polarized, not only in the US, but around the world. And for that, I really think there's many reasons. I think there's just many, many sources of information. And so people are maybe confused or may be led into one path or another, depending on the algorithms they use to see what information might be coming out. It's very hard to vet what's true and what's not. And so those are other areas of concern. But I think the other piece of information is we have done so well. I think somebody called it the magic bullet, the ricochet of the magic bullet. So we've done so well in reducing many of these diseases now that people just don't see them. I'm reading a book called My Brilliant Friend right now about early, last century Italy. It's some girls growing up in a little village outside of Naples. And they talk about, this is not about disease, but they just mention, yeah, every other kid I knew died of tetanus or diphtheria or, some disease. And they said death was around us all the time. We were just used to it. We just don't see that anymore. And that's great. But somehow we need to build that sense that risk is still there. It's not a high risk, but it's definitely a risk that helps us understand why we are trying to prevent disease rather than treat it. And so I'll let my colleagues here speak to the issues as well.
Yeah, Jerome, do you want to focus more on the issue of innovation again and how important it is to build trust around that too?
Well, for those who aren't aware, I used to be state health commissioner in Indiana, worked for a governor, then Governor Pence, before I was Surgeon General. And so I've seen this from inside the Situation Room, inside the governor's cabinet, that push and that pull between the scientific evidence and the desires of policymakers, which aren't always aligned with the scientific recommendations. And that's okay. The one thing I would say is that my job was always to make sure the best scientific information was brought to the table. But that's often contrasted with economic information. People die if their businesses are closed down and they can't put food on the table. And so we have to be understanding of many of the competing variables and be willing to go and sit down with people and not demonize them because they're bringing forth other priorities like housing, like financial issues. If we want policymakers to listen to us, because the question you posed originally was, how important is it for policymakers to rely on scientific evidence rather than political pressure? But it's hard for policymakers if all we're doing, there's this famous saying in the advocacy world that when doctors show up to the State House or to Congress, it says Dr. No, Dr. N-O, not Dr. K-N-O-W. It's that we're always bringing bad news and saying what we shouldn't be doing. And I just want to be honest with you all that we have to do a better job of really being, I think, better partners with all the different groups. We have to be willing to go to the State House in good times, and form those relationships and not just jump in crisis and say, do what I say or bad things are going to happen. Because that's a lot of how we lose trust. So policymakers, evidence-based leadership saves lives. And misinformation, as my colleague, Dr. Murthy, has said, it is a public health threat. But we've got to realize what we have failed to do and what we can do moving forward as public health advocates to be better partners with our policymakers so that they will trust us. There's a saying I want to leave you with here. I try to sneak it into every conversation I have. People need to know that you care before they care what you know. And I think we need to do a better job of showing policymakers and the public that we truly care about them and their priorities, and then they will be more inclined to listen when we present scientific evidence.
So from the advocacy world, Candace, how can you answer the question about getting policymakers to rely more on the science?
Well, as Dr. Adams has said, the decisions they make are only as good as the information they're based on. I think it's important for all of us to recognize that the vast majority of parents, and polling shows the vast majority of voters, which is important to policymakers, believe in vaccines.
Yep.
They vaccinate their children. So there's
Mhm.
so much noise, and the volume of that noise, and candidly, the pulpit that is being told from these days has escalated. But so that's why it's as important as ever for others of us, the people who do believe in vaccines, can reconfirm for folks who have questions the history of vaccine success, their benefits and continuing benefits, and their low risk profile. None of that has changed. There's nothing new here on that front. What is new is just the throwing questions, the misinformation, the disinformation that is out there. The vast majority of people still do vaccinate and believe in vaccinations, but it's so important and incumbent on all of us to again what are your questions? We understand there's questions. Anybody would have questions given the amount of noise going on, but it's important to reconfirm, no, that you're not missing out on anything. The history is still the history. The benefits are still the benefits. These are safety tested. We've been tracking these vaccines as soon as they're launched. The safety systems, surveillance systems are in place. So we know we have great information about them. So that type of thing, I think, is incumbent on us to kind of help interject that into the rhetoric as well and get that information to policymakers so they feel confident.
Mhm. Good. Thank you. I see we have a lot of expertise here on vaccines and innovation. Let me switch now to state government policies. Dr. Adams, as a state government official in the past, what role do you see the state governments now playing in either enabling or hindering vaccine innovation and access? And how can state level policies better support science-based decision-making that protects public health and saves lives?
Well, thank you for that question. The reality is states are where policy meets people. As state health commissioner, I saw how states can enable innovation through flexibility, through partnerships, through trust in experts, or they can hinder it through politicization and inconsistency in messaging. States that empower science-based decision-making protect lives and health systems. States control access and implementation, and public health infrastructure matters. And so real practical tips, because I don't want to just speak at a high level. One of the things that we tried to do was involve the business community in our conversations, because when people are sick, when they're not their healthiest selves, it impacts our economy. And so our biggest advocates for vaccines in our state were often our biggest employers, but we don't think to invite them to the conversation when we're talking about vaccine policy and public health infrastructure. In Indiana, we were successful in securing $250 million for public health infrastructure, not by making the public health case, but again, by making the business case for a healthy workforce. And so I think that is going to be critical. I also think that, as I mentioned earlier, we need to make sure we know who is on our Senate health committees, who's on our state legislative health committees, before there's a crisis, and that we're in constant communication with them so that they know our issues, but so that we're also available to them to provide information. I call up my leaders in the legislature and just say, hey, just wanted to check in. Is there any information that you're seeking about what's going on in the community regarding vaccination rates? And even if I don't know the answer, I will help them get the answer and help them get the answer for the constituencies that they care about and the communities that they live in. Be helpful to them, and then you'll be a trusted resource when things become a crisis.
So I'd like to add that
Yeah.
I agree with that, but I also think that I think we need to support our medical societies as well.
Agreed.
The American Academy of Pediatrics, the American Medical Association, the American Academy of Family Physicians, the American College of Obstetrics and Gynecology, the American College of Physicians, who represent all of the medical and health allies providers in the United States and elsewhere. and are really trying to develop their local policies as well so that they can come to the Hill, either the Hill at the federal level or their local, state, and local government entities. Many of these individuals actually wind up running for office and bring a lot of the science-based policy making to their local communities as well as their national communities. And these are our organizations that are really primarily there to support our patients and their families, and also do that by supporting their workforce, their healthcare workforce. We're facing a bit of a crisis now among our healthcare workforce. They are stressed, they are burned out, they are being threatened in many ways by this current situation. Because even though, as you heard, the majority of people do support some of the innovations and the work that we do, they are getting threatened. I chaired a task force on the well-being of the pediatric workforce and wrote a report on not just a white paper to sit in a shelf, but what can we do? What resources can we provide to our healthcare workforce who are working really hard to try to support the science and the advocacy and serve as advocates in our local communities as well. And so I would encourage all of you who have access to really understand what your medical societies are doing and help support them in the work that they're doing and disseminate some of the work that they're doing as well, because they are really our frontline healthcare workforce. They work in federally qualified health centers, in rural hospitals and clinics, as well as in big academic medical centers and in federal agencies as well. So they are everywhere, and they are really the spokespeople at the front line where the rubber hits the road and helping talk to patients and families.
A quick critical caveat to that, and it's an and, not an or. But because I want to say I 100% agree that we need to support the American Academy of Pediatrics and the American Medical Association and our medical associations. Here's a practical tip for everyone listening. The reality is, and I say this as a member of many of these groups, that the national societies right now are controversial in a lot of the country. And in many cases, hearing that something comes from a national society in a state like Indiana is a reason for legislators and policymakers to almost immediately reject it. I'm not happy this is the reality, but this is the reality in the world that I'm in and that much of our country is in. So what do you do? While legislators may question the American Academy of Pediatrics, they are very open to hearing what the Indiana Academy of Pediatrics is saying in the state of Indiana. While they may not be happy about the American Medical Association in Indiana and the state legislature, they are very willing to listen to what the Indiana State Medical Association is saying. So remember that these national organizations are composed of state chapters which know and have credibility on a state level. And in many cases, reframing it and saying, this is what our state pediatric society, this is what our state medical society, this is what our state nursing or pharmacy society are recommending for our state, is going to be a much more effective advocacy position than framing it in terms of this is what the national society is saying in this contentious time.
And
can I just say something? Yeah, I just want to say something here to add to this discussion about the role of advocacy from the scientific community, from the medical community, from our health workforce community that is burnt out, as Bonnie's saying. But I think, and I'm just going to put a plug in here for the National Hispanic Health Foundation. We've brought together the National Hispanic Health Professional Societies that are nurses and doctors and pharmacists, an interdisciplinary approach that has rarely been seen. And we did this because we understand that they all are busy talking to each other, building their own organizations, and haven't been able to, just haven't had the infrastructure that the AMA has built up over the couple hundred years, right? The AMA has state chapters, local chapters, and these national groups have remained national with a national conference. But they have chapters and they have individual leaders and leadership development. So what we're focused on is what you're talking about, is having more advocacy, but at the local level.
Mhm.
And maybe having, town halls that our Congress members have, or assembly members of the state level, having doctors at those town halls, or having more interaction, so that there is that sense of trust built back up. And so I think both of you have stated, in your own ways, that the importance of the professional and political world. Professionals have to be advocates for their patients, and patients have to be more involved in advocacy. Patient advocacy groups like Candace's group have to be more engaged with policymakers at the local level. And I think that is why we're talking about state government policies. Candace, you were going to say something, and then I'm going to ask everybody to wrap up. And if there's any burning questions, please put them in the chat. Candace?
Sure. So as the only non-physician on the panel, I want to take it down a level, because people might not feel comfortable talking about the science to their policymaker, and it makes sense to refer to someone, but just reaching out and saying, I'm concerned.
Mm-hmm.
What are you doing about lower vaccination rates?
Mm-hmm.
Ask a question. You don't have to have the answer for them, but letting them know, tagging them on social media, calling their office, dropping by their office, any of those, a lot of people are active on social media. You can tag their handle and they will see it. And the volume of that will trigger a response. And it's so important, because a lot of this other rhetoric's out there, they're hearing from those people, but they're not hearing from the majority of people who still vaccinate, who still believe in vaccination. So don't be afraid to say, I am concerned and I have a question. What are you doing to, address this in my community? I'm a voter. What are you doing about it?
Love that.
That has a lot of power.
Yes. We're all important. Everybody's important. And so I don't see any questions right now. I know there was big questions that have been answered by the speakers about trust, and I think that was a couple of the questions. One issue that Henry Montes brought up was, how do you build trust for the innovative type of vaccines that aren't just getting a jab, he said, and to get people to understand that there are more innovations that need to be talked about. Bonnie, do you have any comment on that?
Well, so I spend a lot of my time. Well, I used to spend a lot of my time in the field, in communities, talking to individuals, talking to the leaders of free clinics, of federally qualified health centers, talking to patients one-on-one, and also talking to my state legislators as well, starting being on the federal. So I've really tried to go across that and globally, trying to understand the opinions of everyone. And it's, I think what Candace said is really important, is really trying to bring it back to the individual community level and having people understand, listening to their concerns. I'm a pediatrician, I'm an epidemiologist. I've seen patients for over 30 years now. And I think at its very core, people really want to do the right thing for their families. They really want to protect their children and their families and themselves. It is difficult right now for them to navigate all of the information that's coming across. And I think, as we know, all politics are local, as they say. And so really making sure that our individual local communities have the tools and resources to really just talk to people. I mean, it's helpful to do. I mean, you can start at the top and work your way down, or you can start at the bottom, work your way up. I think both of those are helpful. You need those tools that some central committees can provide, but you need to teach your local community members how to bring those messages to people. And frequently it's those local communicators that really bring in the local communities. And again, it's not just about single issues. As you heard before, people are worried about paying bills. They're worried about food. So when we work on vaccines and FQHCs, for example, we also bring in, the Second Harvest Food Bank people at the same time, and we have people there setting up to enroll people in in our ACA local ACA clinics, and so that they can actually and whatever else they might need. And so we bring in other nonprofits, other groups that may not be providing a direct medical service, but that serve the whole family, the whole community. And I think the FQHCs do a very good job in general at that, because they do have to serve the whole family and the whole community. But as much as we can bring that to the local level, I think that's really helpful. But it's going to take a while to really untangle some of the misinformation that we're hearing now. And really, again, it's a lot about building trust. And I think we need to learn something about how that communication worked or didn't work during the COVID pandemic, because I think that's really triggered a lot of what we're seeing now. It's going to take some time. The trauma of what we just went through the last 6 years, it's going to take some time for people to start to rebuild how they feel. People are very resilient, but they need some safe haven. And sometimes that safe haven is a trusted local leader.
So, Bonnie, I think you've wrapped it up very, very nicely. I want to ask the other two speakers right now, and Bonnie, we'll come back to you for closing remarks. Bringing this all together, we're talking about innovations of vaccines and medicines that like you said, people don't have a sense of all the science that goes into creating such valuable assets for life and for future generations, and the trust isn't there for one reason or another. A lot of it has to do with misinformation, but how do you balance public trust and being able to develop more innovative medicines and vaccines? Candace, this is just your last thoughts.
Sure, I'll be quick. So I think it's important to recognize, to level set on an emotional level, like Dr. Maldonado said. Everyone if we can start with the basic agreement that we all care about doing the best for our children collectively. I think that diffuses the temperature a little bit, is coming at it from an emotional level. And then because it is an emotional decision, people are concerned, people have fear. So coming at it just with data and facts isn't going to get us places. So acknowledging people's doubts, acknowledging questions without judgment, acknowledging the emotion behind it, and finding some common ground about the desire to protect health and children's health in particular, I think is a great place to start. Building trust and then pointing to trusted healthcare advisors and answering questions without judgment.
Yes. Jerome? Dr. Adams?
Quickly, when you talk about messages that build trust, I think we need to focus on shared goals, protecting loved ones, maintaining strong communities, keeping health systems functioning, and highlight the why now. Waning immunity, evolving pathogens, upcoming seasonal risks. Make sure we're presenting that information. Listen first. People want to feel heard. People need to know that you care before they care what you know. And understanding their specific concern allows you to tailor your response to them. From a systems level, simplify the process. Walk-in availability, extended hours, eliminating unnecessary steps is going to be critical for people. Again, don't want to get political here, but many of the communities we're serving are fearful, increasingly fearful of coming in to public places in normal hours. So we're going to have to make sure from the public health standpoint that we're making it as easy as possible for everyone who is considering a vaccination to get a vaccination. And finally, lead with empathy, clarity, but also confidence. And my confidence comes from knowing what I did for my family, for my kids. So I always tell people, I wouldn't recommend anything for you that I haven't gotten for myself or my own children. We get our flu vaccines every year. We get our COVID vaccines every year. And we trust our pediatricians when they tell us that it is appropriate for our kids to get a particular vaccine. And when I lead with this is what I'm doing, that opens up the door for a conversation with other people that I'm having.
And Bonnie, last word.
Yeah, just very briefly, just love what both of my co-panelists said. So the title of our lecture today, or our discussion topic, is Vaccines and Innovation, Protecting the Future. Listen, I am not worried about innovation. We are doing it. I'm at Stanford University, and I know all of our universities here in the US and elsewhere, and our startups. We are producing a generation of amazing leaders in biosciences and engineering, in all the STEM fields, and in the arts and sciences as well. I'm not worried about the future of our workforce. These are smart people. They have the talent. We have the technology to do things that we couldn't do 10 years ago or 4 years ago even. So we are moving at the speed, very rapid pace. That said, I think people get a little nervous about change. So I think the message of trust is so important because we're going to start developing more things. The question is, how well will we be able to implement the good things that we're doing to save people from not just infectious diseases, but cancer, diabetes, Alzheimer's, all the other problems that we are facing, not sadly, but also we're facing them because we're living longer, we're living healthier. So we need to solve some of the problems that our older population is facing. So I am optimistic that we will get through these troubling times because in the end, we all want the same thing. We all want to feel safe, healthy, and happy.
So let me just say that I think our time is up. I wanted to just say that overall, the message, I think, has been loud and clear about the importance of innovation in science. And what we have also tried to make sure everyone understands that it is an individual, one by one, we need more advocacy, talking to your policymakers about the importance of innovation, but also the importance of trust and information, and not just so much of this misinformation that's going out. And I think that government and needs to work more closely with local communities. So that means we have to get engaged with state governments too, and not just rely on federal government. But I do think that NIH, I'm just going to make a big plug for the scientific community here. NIH, through COVID, actually developed coalitions and created new innovative approaches to getting science and vaccines into the communities by having coalitions with community advocates and creating statewide coalitions. I think it was the SEAL program, the CEAL program. I'm not sure about the acronym, but it was very innovative. And I just want to thank Rosa and Alvanza and Amy and the Health Equity Collaborative and all of the speakers today